Cobblestone streets, historic architecture, bustling markets, the allure of old cities is undeniable. Tourists flock to experience their unique charm, a tangible link to the past. But beneath the surface of these picturesque facades lies a complex story, one often overlooked amidst the romanticism. These cities, products of an era predating modern urban planning, harbor a legacy that extends far beyond aesthetics. Their design, shaped by historical forces, continues to impact the health and well-being of their inhabitants today. From the narrow, winding alleys of medieval Europe to the densely packed neighborhoods of pre-industrial Asia, the urban form of centuries past often prioritized defense and commerce over public health. Limited understanding of disease transmission, coupled with inadequate sanitation and ventilation, created conditions ripe for outbreaks. These cities, while vibrant centers of trade and culture, were also breeding grounds for disease, their charm intertwined with the constant threat of epidemics. Today, the legacy of these historic urban environments is still palpable. While modern advancements have mitigated some of the most pressing health concerns, the fundamental layout of these cities continues to influence public health in subtle yet significant ways. From air pollution trapped in narrow streets to the lack of green spaces, the past is very much present in the health outcomes of those who call these cities home. The Industrial Revolution, for all its progress, ushered in an unprecedented wave of urbanization that further strained existing urban infrastructure. As populations swelled, cities struggled to accommodate the influx of people seeking opportunity. Housing shortages led to overcrowding, exacerbating poor sanitation and hygiene. Factories, symbols of progress, spewed pollutants into the air, creating new health hazards for urban dwellers. This period of rapid urbanization highlighted the crucial link between urban planning and public health. Cities that failed to adapt to the demands of a growing population saw a corresponding decline in public health. Life expectancy in many industrial cities lagged behind rural areas, a stark reminder of the human cost of unplanned growth. This era serves as a cautionary tale, demonstrating that urbanization without a focus on public health can have dire consequences. It underscores the need for a more holistic approach to urban development, one that considers the long-term health implications of design choices. The lessons learned from this period laid the groundwork for the field of urban planning, emphasizing the importance of sanitation, green spaces, and sustainable infrastructure. The trajectory of urbanization and its impact on public health has varied significantly across different parts of the world. Examining the distinct experiences of the United States, China, and Europe reveals the interplay of historical factors, policy decisions, and cultural norms in shaping urban health outcomes. Each region offers valuable insights into the complexities of urban development and its lasting consequences for public health. The United States, with its early embrace of the automobile, witnessed the rise of sprawling suburbs and car-centric urban design. This approach, while offering individual mobility, contributed to sedentary lifestyles, air pollution, and the erosion of community spaces, impacting public health in unforeseen ways. China's rapid urbanization, largely concentrated in recent decades, presents a different set of challenges. The sheer scale and speed of development have strained resources and led to environmental degradation, impacting air and water quality, with implications for respiratory and other health issues. Europe, with its longer urban history, grapples with the legacy of medieval city layouts juxtaposed with modern development. While many European cities boast well-preserved historic centers, they also face challenges related to air pollution, limited green spaces within dense urban cores, and the need to adapt aging infrastructure to modern needs. These diverse experiences underscore the importance of context-specific urban planning strategies that consider the unique historical trajectory and current challenges of each region. The United States, a nation built on the promise of individual freedom and opportunity, adopted a uniquely car-centric approach to urban planning in the 20th century. This model, while offering convenience and mobility, has had unintended consequences for public health. The sprawling suburbs, a hallmark of American urban design, have contributed to sedentary lifestyles, with long commutes replacing active transportation. This lack of physical activity has been linked to a rise in obesity, heart disease, and other chronic conditions. Furthermore, the emphasis on private vehicles has resulted in a significant increase in air pollution. Exhaust fumes, particularly in congested urban areas, contain harmful pollutants that impact respiratory health, particularly among children and the elderly. The design of American cities, with their wide roads and sprawling layouts, has inadvertently created environments that discourage walking and cycling, further exacerbating these health issues. This car-centric model has also eroded the sense of community that is often found in more walkable, mixed-use neighborhoods. The lack of social interaction and connection, exacerbated by long commutes, and the isolation of suburban living, can have detrimental effects on mental well-being. The design of our cities, while intended to provide comfort and convenience, has inadvertently created barriers to social connection, impacting the overall health and well-being of residents. Section 5. China's urbanization boom, a double-edged sword. China's rapid economic growth in recent decades has been accompanied by an unprecedented wave of urbanization, unparalleled in human history. Hundreds of millions of people have migrated from rural areas to cities, seeking better opportunities and a higher standard of living. This massive influx of people, while driving economic progress, has also placed immense pressure on urban infrastructure and resources. The sheer scale and speed of urbanization have posed significant challenges to maintaining and improving public health. Air pollution, largely a result of industrial emissions and vehicle exhaust, has become a major health concern in many Chinese cities. The rapid construction of factories and buildings, often with lax environmental regulations, has contributed to poor air quality, leading to respiratory problems and other health issues. Moreover, the density of urban populations, coupled with challenges in waste management, has created concerns about water contamination and the spread of infectious diseases. The strain on healthcare systems, struggling to keep pace with the growing demand, has further exacerbated these challenges. China's urbanization, while an engine of economic growth, serves as a stark reminder of the importance of sustainable urban planning that prioritizes both economic development and public health. Section 6. Europe's urban fabric, a blend of history and modernity. Europe's cities, with their long and storied history, offer a unique perspective on the interplay between urban design and public health. Many European cities, particularly those with medieval origins, were developed centuries before the advent of modern urban planning principles. Their narrow streets, originally designed for pedestrians and horse-drawn carriages, now struggle to accommodate modern traffic, leading to congestion and air pollution. While European cities generally boast robust public transportation systems, reducing reliance on private vehicles, the legacy of their historic layouts continues to pose challenges. The dense urban form, while promoting walkability, can also trap pollutants, impacting air quality, particularly in areas with limited green spaces. The preservation of historic buildings, while culturally significant, can sometimes come at the expense of modern building codes that prioritize energy efficiency and ventilation. Despite these challenges, European cities also offer valuable lessons in sustainable urban living. Many have successfully implemented policies that promote cycling, pedestrianization, and the development of green spaces within urban cores. Their emphasis on mixed-use neighborhoods, where residents can access amenities and services within walking distance, fosters social interaction and reduces reliance on cars. Europe's experience demonstrates that balancing historical preservation with modern urban planning principles is crucial for creating healthy and livable cities. Section 7. The Unseen Hand: How Past Choices Shape Current Health. The built environment, often taken for granted, exerts a powerful influence on our daily lives, shaping our behaviors and ultimately our health. The way our cities are designed can either promote or hinder physical activity, social interaction, and access to essential services. Decisions made generations ago, often with little consideration for long-term health implications, continue to resonate in the health outcomes of urban populations today. Consider the prevalence of chronic diseases such as obesity, heart disease, and diabetes. These conditions, while influenced by individual choices, are also significantly impacted by the environments in which we live. Cities designed around cars, with limited opportunities for walking, cycling, and active recreation, contribute to sedentary lifestyles, a major risk factor for these chronic illnesses. The lack of green spaces in many urban areas further exacerbates these health issues. Parks, gardens, and tree-lined streets provide essential respite from the stresses of city life, offering opportunities for physical activity, relaxation, and social connection. Yet, in many cities, access to green spaces is unequally distributed, with lower-income neighborhoods often bearing the brunt of environmental burdens, such as air pollution and lack of green spaces. This inequitable distribution of resources perpetuates health disparities, highlighting the need for more equitable and just urban planning practices. Section 8. Green spaces, blue spaces, nature's antidote to urban stress. Amidst the concrete jungles of our cities, nature offers a powerful antidote to the stresses of urban life. Numerous studies have demonstrated the positive impacts of green spaces on both physical and mental well-being. Exposure to nature, even in small doses, can reduce stress, lower blood pressure, and improve mood. Green spaces provide opportunities for physical activity, encourage social interaction, and offer respite from the noise and pollution of urban environments. Access to blue spaces, such as rivers, lakes, and coastlines, also confers significant health benefits. Water, with its calming presence, has been shown to reduce stress and promote relaxation. Blue spaces offer opportunities for recreation, such as swimming, boating, and fishing, promoting physical activity and social interaction. Moreover, the presence of water in urban areas can help mitigate the urban heat island effect, reducing temperatures and improving overall comfort. Incorporating green and blue spaces into urban design is not merely an aesthetic consideration, but a crucial investment in public health. Creating walkable, green neighborhoods with access to parks, gardens, and waterfronts can encourage physical activity, reduce stress, and foster social connection, ultimately creating healthier and happier urban environments. Investing in nature is investing in the well-being of urban populations, creating cities that are not only functional, but also restorative and life-enhancing. Section 9. Rethinking our concrete jungles towards healthier urban futures. As cities continue to grow, grappling with the challenges of sustainability and public health, it is imperative that we rethink our approach to urban design. The legacy of past decisions while shaping our present does not have to dictate our future. By learning from the mistakes of the past and embracing innovative solutions, we can create healthier, more equitable, and livable cities for all. A key aspect of this transformation involves prioritizing active transportation and reducing reliance on cars. Investing in safe and efficient public transportation, creating dedicated bike lanes, and promoting walkable neighborhoods can encourage physical activity, reduce air pollution, and create more vibrant public spaces. Furthermore, incorporating green and blue spaces into urban design should be a priority, not an afterthought. Parks, gardens, and waterfronts are not mere amenities, but essential infrastructure for healthy cities. They provide vital ecosystem services, mitigate the urban heat island effect, and offer residents much-needed respite from the stresses of urban life. By weaving nature into the fabric of our cities, we can create environments that promote physical, mental, and social well-being. Section 10. Conclusion. A legacy etched in stone, a future we can shape. The legacy of urbanization is etched into the very fabric of our cities, shaping the health and well-being of billions. From the narrow streets of historic cities to the sprawling suburbs of the 20th century, the choices made by previous generations continue to resonate in the present day. However, this legacy, while undeniable, does not have to be our destiny. We have the power to learn from the past, to acknowledge the interconnectedness of urban design and public health, and to chart a new course towards healthier urban futures. By embracing sustainable urban planning principles, prioritizing active transportation, and incorporating nature into our cities, we can create environments that promote physical activity, reduce stress, and foster social connection. The task before us is not simply to build cities, but to cultivate thriving urban ecosystems where human health and well-being are paramount. The cities of the future can be places where history and modernity coexist, where the lessons of the past inform a more sustainable and equitable present. By recognizing the profound impact of urban design on public health, we can create cities that are not only marvels of engineering and architecture, but also beacons of health, well-being, and human flourishing.